Welcome to the Quality Insight video blog. We're glad to have you along on this adventure as we discover the best ways of using Quality Insight to make care better and safer for patients in Saskatchewan. Quality Insight is a presentation of the Saskatchewan Health Quality Council. In this episode, you'll hear why Cypress Health Region wanted to have its own visibility wall on Quality Insight.
Some of our big work is around supporting Cypress, who is interested in publishing their whole strategic dashboard to Quality Insight. And so our team here has been working through a fairly intensive indicator development process.
We're all kind of just itching to see what the dashboard looks like once it's up and running with actual data in it. And we all see this as a very small step in a very long journey. Someone needs to blaze the trail a little bit before I think anyone else is going to take that step.
I'm pleased at how far we've come. I honestly didn't expect us to get this far and to have actually something that we've created today to be able to take forward and move on. But it's good because people need to have that tangible task done. They need to know that they've accomplished something.
Basically last week or the week before, we developed the plan for the next 90 days. On these Monday meetings, our goal here is to say, here's what we did, this is what we said we were doing, this is what I actually did, and this is what I learned from what I did last week.
Creating a set of indicators for a regional visibility wall is a collaborative endeavor between the Health Quality Council and Cypress Health Region. Together, we determine what information is most useful to the region. We find existing indicators or create new ones. We find ways to collect data for the indicators, and we find a way to transfer the data to HQC for posting on Quality Insight.
The difference between a regional dashboard and Quality Insight Online is basically that the regional dashboard is much more specific to the region. So whereas Quality Insight Online has over 100 indicators, the dashboard is really just a much smaller, more specific look at things to see how we're doing in the region.
To get the Cypress Health Region dashboard indicators on Quality Insight Online, we started approximately 9 months ago in terms of gathering definitions, in terms of what data did we need in order to get those indicators up onto Quality Insight Online.
We came up with 13 that are up right now, and will be 16 indicators that are going up.
On its visibility wall, Cypress Health Region's initial set of indicators tracks progress on their quality improvement initiatives, for reporting to the Ministry of Health on its strategic and operational priorities, and for reporting to Accreditation Canada.
We worked a lot with HQC in terms of defining what those indicators meant, so that when we put those indicators on Quality Insight Online, people could go to the notes page and get a good understanding of what's the numerator, what's the denominator, and what are we trying to accomplish by tracking this indicator.
With the indicators that you look at and the data that you have, do you find that they're the right measures?
Part of our struggle is we need to then develop something different so that we can gather the data in a form that is actually useful to making improvements in the front line.
Cypress Health Region wants its staff, leaders and managers, and the public to look to Quality Insight for information on how the region is performing. They expect it will inform and drive improvement in the care they provide.
Ultimately, we want to be able for not only the residents of our region to be able to go in and see how we're doing, but also for our directors, our managers, our staff, our board, SLT, to be able to utilize this information to make decisions and to make the patient experience better.